hospital is one of the noble concepts. I think what we are really look at, if you look at the government expenditure, of course, in the last several years, I think he also alluded to that there is a lot of investment by the government. If you look at the private sector also, I mean, in fact, in Nepal, if you look at the expenses, it's more coming out of the pocket rather than the government on an average. But again, I think there has been a tremendous amount of improvement in terms of the policies and in terms of the many initiatives that have been taken. He was talking about the maternal mortality rate, the child mortality rate. I remember taking an award in the UN for having made a substantial progress in 20 years period, both on the maternal mortality rate as well as in the child mortality rate. I think that's why I think what it shows is that these things are doable and they are desirable. That's why I think this is the next stage that he's talking about is very, very important. Our challenge is to make sure that we are affordable, but also accessible and quality. These three things, of course, it's easier said than done. He was showing us the SDG, and if you look at the non-communicable diseases impact on countries like ours, we all thought it is all about communicable diseases before. But now, maybe we have made a good progress on the communicable diseases, but now the NCDs are coming as a prominent challenge for all the countries, including, we thought it is only of the developed countries, but now it is for the developing countries as well. That's why, and especially looking at the children are the future. He was more eloquent, perhaps we can be more eloquent than what he was already showing. I think he is talking about investing in future. That's why I think this is a wonderful project. And I'm not saying that we have to say it, but because it looks like that, that's what I'm saying it. And I'm sure that you have looked at his presentation. We are very glad. And I must say that two things before I end my appreciation of what he has done, is that it has always been a collective effort of all in terms of the promotion of the health sector in Nepal. The government, but the private sector, the communities. It is the joint, I think, the work of all of us that we have reached where we are now. That's why, and the part of that, I mean, that international support has always been there. Look at the focus of the international community, whether it is the maternal mortality, or whether it is the neonatal, or whether it is the 1,000 days program. These are all international, huge international support. And if you look at the the health sector and the United Kingdom has been there in the health sector for a very long time. And we have done, I was just thinking, when I was doing that, so many doctors are here. So we were always thinking that yes, the United Kingdom has also helped a lot in Nepal, but then maybe we can also say that we have also helped NHS here. There are so many of you in the as a doctor or as a nurses, as a caregiver, you have been also contributing to the health sector in Nepal. So maybe you can think about this partnership in a new way now. It's kind of an exchange, partnership going both ways. And this is a wonderful idea, I think, that he has presented. I'm sure that there will be a very strong support, as he has outlined, to this project. And let us move forward, have a future of our children secure. And that starts with the health. Thank you very much.